Hello, my name is Машаракина Diana. I study at Ural State Medical University, Faculty of Dentistry. My scientific director is Gaisin Елена Фахаргалеевна. She is candidate of medical sciences, associate professor of the chair of pharmacology and clinical pharmacology. I want to tell my report about the use of local anesthetics of the Amide group in patients at risk at a dental appointment. Let's begin. The importance of the correct selection of drugs for local anesthesia for patients at risk at a dental appointment. Dentists in their daily practice should carefully select local anesthetic medicaments for patients at risk. It's too important because the composition of carpals should be taken into account. The content of vasoconstrictor, epinephrine, additives to make better help for patients. Also, you should pay attention to possible interaction of local anesthetic solution components with the medicaments used by the patient for concomitant pathology treatment, as well as the pharmacokinetics and pharmacodynamics of the medicament. Local anesthetics at a dental appointment are used to reduce the physico-emotional excitement and pain of patients, because at the dentist's appointment, they often experience stress associated with the upcoming doctor's manipulations. Stress can trigger an epileptic seizure, an attack of bronchial asthma, and increased blood pressure. A properly selected drug for anesthesia is the key to successful treatment and prevention of life-threatening conditions at the dentist's appointment. In picture number 1, you can see carpals and carpal syringe. In picture number 2, you can see dentist at the appointment. The most relevant anesthetics, mepivacaine. Nowadays, anesthetics based on articaine and mepivacaine are the most relevant. Mepivacaine is the only amide-type anesthetic that can be used without the addition of vasoconstrictor, as it has a less pronounced vasodilating effect, which allows it to be used in cases where the use of anesthetics containing epinephrine and adrenaline is undesirable, in patients with heart failure, diabetes mellitus, bronchial asthma, and allergies to drugs containing sulfur. Trade names: mepivacaine DF in picture number 3 and mepivastazine Scantinest in picture number 4. The most relevant anesthetics, articaine. The advantage of using articaine is the formation of non-toxic articatic acid due to the mechanisms of biotransformation by liver enzyme systems and esterases of tissues and blood. And also, the excretion of articaine occurs faster than other amide anesthetics. Articaine is the medicament of choice for liver and kidney diseases in elderly patients. It's important to remember that articaine preparations are used with a vasoconstrictor epinephrine. In Russia, Ultracaine D in picture number 5, Septanest in picture number 6, alphacaine, ubistazine, primacaine, and cytocartine are allowed to use in dentistry. Contribution of Russian scientists in the study of anesthetics of the amide group, Part 1. In 1956, mepivacaine was originally synthesized in Sweden. At the same time, at the Institute of Pharmacology and Chemotherapy of the USSR Academy of Medical Sciences, in the laboratory of Professor Ponomaryov, was synthesized and studied the first national amide anesthetic, mesocaine tromicaine, in pictures 8 and 9, a derivative of xylidine. Mepivacaine is also xylidine's derivative. This anesthetic was studied in detail by Professor Branichnikova in 1956, 57, and 59. In an experiment, as well as by Professor Sharov in 1962 and 1964 in clinic. For the first time in dental practice, this medicine was used by Associate Professor Yuri Iosifovich Bernatsky in picture number 7. In December 1957, at the dental clinic and polyclinic of the Cuban Medical Institute at Krasnodar. In 1960, in the magazine Dentistry number 2, Yuri Iosifovich summarized the experience of 128 surgical interventions under mesocaine anesthesia. Contribution of Russian scientists in the study of anesthetics of the Amide group, part 2. Articaine, in pictures 10 and 11, was synthesized in the 70s, and since 1990 it has been allowed in Russia. It has been used in dentistry since 1994. The first approbation was conducted by Professor Shugailov in picture 12 at the Moscow Medical Dental Institute, now Moscow State Medical and Dental University. Conclusions. First, the choice of a local anesthetic of the amide group depends on the presence of a vasoconstrictor in the carpals. When using local anesthetic medicaments, which include a vasoconstrictor, it's necessary to take into account its effect on concomitant pathology as well as on the effectiveness of treatment. Second, mepivacaine-containing anesthetics, mepivastidine, Scandanest, have found wide use in dentistry. For the certain group of patients, they are the only drugs for local anesthesia due to general somatic pathology. Third, articaine-containing anesthetics are the leading medicaments for local anesthesia due to the peculiarities of biotransformation in the body, effectiveness and duration of action. This is my list of used literature, and thank you for your attention.